think of yourself, somebody putting something in, so.
Not that much, you mean? Not that
No,
much?
I'm saying you put a lot on.
Yeah.
That's
Try
why
to
I
make
said,
it as
be sure you
juicy as
pencil that
possible.
out so that you have a lot to put on it.
So first thing I have to do is check the balloon, right? Okay. It's already connected to the bag, so I don't have to do anything with that. How much do I have to insert? I check and the balloon says 5 cc's. The book says 10, between 5 and 10, depending on the catheter.
Follow the catheter.
And let's see, the balloon inflates fine. 5 cc's. Inflate. Do you see the balloon inflating?
Where is it? Oh, yeah.
Right?
Oh, yeah.
Right. Okay, so it's not leaking. I deflate the balloon. Stop doing that. I will need this. I put the water back because I will need it, okay? For one is inside. Okay. Now, I have my catheter here. I make a look. Oops.
Can I just say something?
Yeah, say so.
Before you even mess with that catheter, when you're getting all this checked, make sure that's clamped, so that the Foley doesn't leak. If it's got a clamp at the bottom, the Foley bag.
Oh, this on the back.
Because once you start getting urine, if you don't, you're gonna have urine all over the place. And sometimes they come clamped, but it's always better just to double check.
It's a habit, a good
You know what you say? If this is clamped. See, closed, open.
Because if you don't, you'll have such a
Because
mess.
if this is open and these patients, remember, we put the catheter center, the patient has a couple of liters inside. So all the urine comes out and it starts leaking, but this is clamped.
Just a little practical.
Okay. So I keep this inside. Okay. So I lubricate the Foley catheter. I try not to touch the gloves, the jelly with my gloves, for a practical reason. Once I get my hands dirty with povidone plus this thing, everything is slippery, then you cannot do anything. Okay? So this is ready, and I leave it here in hand. Okay? Now from now on, I'm going to touch this catheter with which hand?
You're right.
Right hand. Your
Right
dominant
hand only.
right?
Okay? So I spread the labia.
So
And
now
this
you're
is-
dirty.
This hand is dirty and I cannot see anything what I'm doing, but I don't want to distract. So I clean from top. Let's say I can spread it. I clean from like this. I clean from top to bottom. I don't want to touch this thing.
Yeah.
From top to bottom one time and discard wherever I have my discard thing.
Yeah, you've got a garbage can over
Yeah.
there. Imaginary.
From top to bottom and then the meanders. See, I have to use this hand for everything. I cannot touch anything but sterile thing. Once it's clean, I just grab the Foley catheter. Once I spread the labia, I have to keep it, hold it, cannot close. If it closes,
You're
I have to contaminate. That's why sometimes it's very useful to have this on hand, extra, and to have somebody who will help you if you need help. Open me one more of these. And then I say, see, it's about like a couple of centimeters from the tip. If I get like this, see how it's difficult, okay? If I get too close, I get all the jelly in my fingers, so then it's difficult. Okay, imagine I kept it on, and then I have to visualize what it's done. Of course, you don't have a tie that is on the way, okay? And without touching anything, I aim at and it went through, okay? And let's say I have urine coming out. What do I do next? I advance a couple of inches more, so I know, I'm sure I'm in. Now, I switch hands, okay? This is dirty, this one is clean, but now I switch hands, and it doesn't matter if this is the dirty, because I'm not going to insert anymore. What I'm doing, I'm holding the catheter, so I have my dominant hand, and I can do like this any way I want. I can just here with the draperies program, put my 5 cc's. And I'm not going to put it in because it's very hard. I don't know if there is a bladder in there, it's all tubing. So, but once you put your 5 cc's, it's there inside, you remove and you pull back slightly and you feel that it's not coming out, it's there, okay? It's in place. You have urine coming out. If you need to take a sample, this is all, hasn't been used at all, you can collect the sample from here, no big problem. But this is the only time that you collect the sample from here. From now on, every time you need a sample, you collect from the sample port. If you don't have urine in the catheter, you clamp the catheter with this or with whatever you use to clamp. You clamp the catheter, you collect urine. Once you have the urine here, you swab sterile with an antiseptic, put a syringe, draw your urine, and put it in the cup. Remember that you use sterile technique if you have to get a culture, you need sterile technique. But even if you have to get the UA, you use a sterile technique. Why?
Contamination.
Because you don't want to contaminate inside the floor. So you have this like this. You have your tape somewhere. So you put your tape. You touch. Well, this one needs to come out. You can break it. You put your tape somewhere so you prevent pulling. So this is messy. Okay. Huh. Okay.
It's really hard when you have gloves,
Hi.
because the tape really
Well,
does.
I need another tape. Where's my tape? Where's my assistant? Give me a piece of
And
tape.
actually, once you get it in like that, this part really isn't the sterile
Yeah.
part anymore. So, you know, if you need
If
to
I
take the
get
gloves
the
off to
gloves
do
off.
your tape, to get it a little bit better, you can do that. It's the
So you
part that's
put,
going
thank you
into the
very much,
bladder that
Doctor.
abs, you know, I mean,